Hi Bernie, my name is Joe and I'll be your physical therapist today. I saw on your chart that you're having some neck pain and it's kind of shooting down your arm a little bit. Can you tell me a little bit about that?
I don't know, I was just out in the garden and I was like raking, doing stuff like that, and all of a sudden, boom, it just came on.
Okay.
It's like 2 weeks ago, it has been really bugging me.
Okay.
It hurts pretty bad, so.
So it came on while you were raking. Was there anything like a traumatic incident that happened while that brought on the pain?
No.
Okay, sounds good. So that helps us a little bit, just make sure that you're safe in the clinic. We're going to do a couple more screenings just to make sure that you're safe to be in the clinic, and we're safe to assess you and move you around a little bit today. So what I want to know is, I guess, have you had any rapid weight loss recently?
No.
Okay. Have you had any change in vision?
No.
Any change in speech or anything like that?
No.
Okay. Have you had any change in consciousness, any fainting, dizziness, lightheaded, anything like that?
No.
Okay, sounds good. Another thing that I want to ask is, do you have any like bowel or bladder changes that you've noticed since this history?
No.
Okay, sounds good. I would say for the most part you're going to be safe, and we're going to do a little bit more of assessment to make sure that you're safe to be here. I would want to take your heart rate, blood pressure, and take your respiratory rate. We're going to skip towards that.
Okay.
We took your blood pressure, heart rate, and respiratory rate. You're safe to be here, and we're ready to go with the assessment now. So what you described to me is a little bit of symptoms that follow the nerves. So we call them neural symptoms. So what I'm going to do is just a screen to assess a little bit more of your symptoms with your nerves, which are a little bit of how you're feeling and how you're using your muscles, how you're turning your muscles on. Okay, so the first test, I'll have you take your hat off or turn it backwards. It's up to you. Okay, so I'm going to assess how you are interpreting feel. So I'm going to touch various points on your body. Is that okay?
Yeah.
Okay. So how does that feel? Does it feel the same?
Yeah.
Okay, so I'm going to go through different points of your arm. I just want you to let me know if you feel it, when you feel it, and if it's the same on both sides.
Okay.
Okay, I'm going to roll up your sleeves here. Then I'll have you close your eyes.
Okay.
Okay.
Feels about the same, yeah.
The same? Okay.
It feels the same.
Okay.
A little bit less on the left side.
Okay. One more time.
Yeah, so it feels a little bit less on the left side.
A little bit less on the left side.
That feels more like it's the same.
Okay.
Yeah, that one felt the same.
Okay.
That one felt the same.
Okay. So that's the end of the feeling test that we have for you. It's showing that you have a little bit of loss of sensation down in your hand, which you told us in the subjective. So we're gonna try to find a little bit more about that through our assessment. Okay, next we're gonna see how you're using your muscles. So what I want you to do first is push your forehead into my hand. Try to resist my hand. How are you feeling?
It's a little irritating just on the left side of my neck.
Okay.
It's not too crazy.
Okay. All right. Now I want you to try to push your ear towards your shoulder. Hold you. Push in my hand. How's that feeling?
Good.
Okay. Now we're gonna go to the other side.
That one's a little more irritating.
Okay.
Just a little bit.
Is it tolerable?
Yeah.
Okay. Okay. How'd that feel?
Good.
Okay.
Great,
Any
but-
symptoms lingering, or just while we were moving them?
Just while I was getting
Okay. Sounds good. And where did you feel it?
It just kind of goes over.
Down your arm? Okay. Anything in the neck or just down the arm?
No, there's a little bit irritation.
Okay. Next, what I want you to do is push your hand up into my hand. Okay. And same on this side. Push in my hand. Okay. Any pain with that?
A little bit of pain, but
Okay. Just the weakness
Just
that
the
you're
weak,
noticing?
yeah.
Okay. Okay. Can you push in my hand now? Okay. Do the same on this side. Alright, how'd that feel?
it felt pretty good.
Okay, felt pretty good too. Sounds good. Next, what I want you to do is, can you squeeze onto my fingers? How's that feeling?
It feels good on my end.
Okay. I feel a little bit of weakness with your left hand, but as long as there's no pain, that's pretty good. But there's a little bit of weakness there. Okay. Next, what I'm going to do is I'm going to do some reflexes just to see how your nerves are firing with the reflexes. A little bit less over here on the left side. Yeah, a little bit less on the left side as well. We're gonna do one more. Oh, that was good. Awesome. Any pain with any of that?
No.
Okay. Next thing I'm going to do is just make sure that there's nothing going on bigger, any bigger, more problematic things with your nervous system. Okay. Okay. This is called Hoffman's test. And what we're looking for here is to see if you're pinching your thumb at all, which you are not, so that's good. Next, can I have you swing up and have your feet on the edge of the table?
Like this?
Yes. Okay. This is a clonus test.
Okay.
And what we're looking for is to see if your feet are kicking back while we're doing that quick movement. If I could also do the Babinski test, which is stroking it along your foot, but it seems maybe good, so we'll save some time here. Okay. Next, what I want to do is see how your neck's moving, and see how that works a little bit.
Okay.
So what I want you to do first is, can you just move your neck forward?
Oh.
Okay.
Oh.
How's that feeling?
A little irritating, but it's not too crazy.
Okay. Can I put my hands on a little bit and add a little bit more pressure?
Makes it a little more irritating, but it's not too bad.
Okay, you can sit down. Yep, I'm feeling a little bit more of some muscle guarding and some twitchiness with that. So, okay, now can I have you put your ear to your shoulder? Okay. How's that feeling?
That's good.
Okay. Go to the other shoulder.
No,
How's
it's
that
not as good.
Okay.
But it's not.
Where are you feeling that?
Just a little bit in the neck. It kind of just
In the
tingles
neck?
a little bit.
Down the arm a little bit? Okay, sounds good. Next, what I want you to do is try to make as many chins as you can. Add a little pressure to it?
Sure.
Okay, how's that feel?
Good.
Okay. Next, what I want you to do is, can you look up? Okay. How's that feeling?
Good.
Okay. Next, can you try to look over your shoulder? Perfect. How's that feel? Good. Okay. Go the other way.
I don't like that way as much.
Okay. Yeah, you're a little bit limited in that direction as well. Okay, sounds good.
All right, hi Bernie, my name is Noah and I am a student physical therapist, and what I'm going to be doing right now is I'm going to pick up where my colleague left off, and I'm going to take you through a couple different motions of your thoracic spine, so the middle of your back, and then just a couple special tests so we can really understand what's going on inside your neck. Let's get down to the bottom of it. So first, I'll have you remove your shirt just so I can assess your skin real quick. Perfect, thank you. And then what I'm gonna first start by doing is I'm gonna first start by assessing the motion at your CT junction. So what I'm gonna do is I'm just gonna provide just a slight flexion moment here, lateral flexion moment, and just check on how you're moving on each side. You just let me know if there's any symptom provocation here or anything that you feel is familiar in regards to your pain, okay?
Okay.
Does that feel okay?
Oh, pretty good overall, yeah.
Okay, so what I'm gonna have you do now is I'm gonna have you extend as far as you can, just kind of, there you go, perfect. You can keep your head a little bit more neutral. Good, so now I'm just gonna rotate and clear that one more time. Good. Next, what I'm gonna have you do is I'm gonna have you slump down, just like, there you go, perfect. And then what I'm gonna do is I'm just gonna assess the mobility of your thoracic spine here. I'm just gonna provide you just a little weight shift here. Getting right on that side of that spine here. Okay, one more time on the other side. Certainly some slight limitations as we get to the bottom. Let's have you do that extension pose one more time. Perfect. Now what I'm gonna do is I'm just gonna check for how well these facets are closing. And if there's any restrictions here. Start up here. Perfect. Okay, next, Bernie, what I'm gonna do is, I know that you're having a little bit of problems with bending your head toward the left side. So what I'm gonna do though is I need to check and make sure that your rib is moving okay and make sure that that's not provoking any pain or any of your symptoms. So what I'm gonna do is I'm going to have you bring your right ear to your right shoulder for me. Good. So what I'm doing here is I'm just picking out the muscle fibers that I'm looking for. Good, you can relax. Then what I'm gonna do is I'm gonna rotate your head. Feel that tautening? I'm just gonna have you just let me know when you feel any symptoms. Your motion feels overall very good. Did you have any symptom provocation with that?
Maybe a little bit. It wasn't too bad though.
Okay.
Like, very minimal.
Sounds good. Any like familiar symptoms? We're just gonna do it to the other side now. Your rotation certainly is a little more limited going this way.
The rotation just kind of tweaks a little bit, but it's not too crazy. It's still okay.
Okay. Yep. Okay. So I can pretty much rule out rib dysfunction for you. You got great mobility when we're looking for what we call that lateral flexion, where you bring that ear down. So next, what I'm going to have you do is I'm going to have you I'll have you stay sitting here first. One more time, I'm going to have you just slightly bring that right ear to that right side, just doing the non-provocational side first. And what I'm going to do is provide just a little force on the top of your head. Is that okay?
Yeah.
Okay. You just let me know if anything changes your symptoms.
That's not too bad here.
All right. Let's do that to the left side. And then I know that this is a little bit aggravating potentially, so I'm going to go a little bit lighter, okay?
Oh.
Right there?
Yeah.
Does that recreate what you've been feeling a little
Yeah.
bit? Okay. Sounds good. Now I'll have you lay down for me. What we're going to do now is we're going to get into a couple of other tests that really help us to be able to understand if what's going on in your neck is nervy. So what I'm going to have you do is scoot just a little bit towards me. I'm going to have you bring your shoulder just up. And what I'm going to do is, if I can just sneak under here, could you just lower yourself down just slightly? Perfect. I go down here. I'm going to just make sure that I get your fingers all set up. Perfect. I'm going to supinate that wrist, bring it into external rotation. Good.
That's pretty tight. Yeah.
Yeah, okay. On that right side. Okay.
Yeah.
Now let's check that left side, okay? So what I'm gonna be looking for is any reproduction of your symptoms or neurological symptoms. So I have you scoot towards me one more time. Perfect. I'll grab these fingers for you. Just let me know if you are noticing anything here, okay?
Ah!
Right there?
Yeah.
Okay. Sounds good. So let's try that one more time. And I want to see if we can get rid of those symptoms. So right here, you're
Ouch.
feeling it. Can you bring your right ear to your right shoulder?
That makes it worse.
Okay, good. Now let's bring your left ear to that left shoulder. That makes it better?
Yeah.
Okay, good. All right. Next one I'm going to do quick is just to kind of conclude our cluster. I am going to just get a little bit of assessment of the soft tissue as well as provide you just a little bit of a distraction, okay? So what I'm gonna do is I'm just gonna take your head, I'll have you scoot back just slightly. I'm gonna put my hands just on your neck. You can just relax here. And I'm just gonna give you a nice little pull, okay?
Ah, that feels good.
Feels good? All right. Would you say that gets rid of some of your symptoms?
Oh, for sure.
Okay, good. All right. Now I'm just going to assess the motion at your individual segments of your neck real quick. What I'm going to do is I'm just going to get you a little bit of extended. Just kind of work through each side. Nothing too bad here. Or anything that
That motion feels good.
Okay, good. What I'm looking for here is just any restrictions or any provocation at any of the joints. So now what I'm going to do is I'm going to slightly flex you.
I don't know, that my neck flexing forward doesn't feel great, but it could be worse.
Okay. Now let's kind of, this one could be a little bit,
I don't like that one.
you don't care for this side. Yeah, right at that about C5, C6 region. Definitely notice a little bit more of that guarding and apprehension.
It doesn't
when we
feel
get
good.
around there. And yeah, perfect. All right. Then also what I want to just do quick is I want you to just sit up for me. I'm just going to get a quick postural assessment before our next PT comes in and explains a little bit about what we're going to be performing in physical therapy should you choose to stay, okay? So what I'm going to do is I'm just going to take a peek at your posture, see if there's anything that we are noticing. Definitely a little bit of chin. Your chin is a little bit forward and a little bit of protraction here. And then definitely some excess cervical flexion, most likely from this patient sitting at the desk for a while. Definitely has a little bit of a rounded upper thoracic spine with a little bit of excessive kyphosis and rounded shoulders. Just gonna also assess our inferior angles of our scapulas to see if they're level. And this one on the left side, we have just slightly more protraction over here and a little bit more winging on that left side. So basic postural assessment that I'm noting, also some higher tone and guarding on this left side as well.
Hi Bernie, my name is Paige. I'm going to be telling you a little bit more about what we found today. I'm sure you're kind of wondering still what's going on and what's causing all of your symptoms, but some maybe for you. So the good news is the stuff that you've been telling us, what we saw, it all fits in the same little bucket that we call cervical radiculopathy. And I know that might sound like a big medical word, but I want to ensure you it's something that we're familiar with and we see a lot, we can work, and we can help you get better.
Okay, that's awesome.
So, if you've seen one of these before, a little model, but we have a lot of nerves that run out of our spine, right?
Yeah.
And up here in your cervical region, one of these nerves is kind of getting pinched off. See how it comes out a little hole here? And we're getting a little irritation, compression of that nerve. You like the garden, right?
I love the garden.
Yeah, so we can kind of think of it like a garden hose. If you have a garden hose running out and someone steps on it, right, we compress it and now it's not flowing as good.
That makes sense to me.
Yeah, so what we want to help you do is relieve some of that compression, the irritation, and reduce some of your symptoms, all that tingling, numbness, the weakness, that kind of stuff.
Okay.
Any questions so far?
I don't think so.
Good.
You're explaining it very well.
Okay. And I know some of your goals too, right? You don't want to have surgery. We want to get you back to work as soon as we can.
Yeah.
And we can help you do that with you working with us, doing some home exercise programs. We're going to try and teach you a little better posture when we're sitting at our desk, do some strengthening of your upper back and your shoulders. And we can also do a little bit, they're called nerve glides. So not only is there water, right, flowing through your nerves that flow like a hose, you can also move your nerves, and your nerves want to move. So we want to help you introduce some movement into that nerves and hopefully free you up there a little bit. Does that sound okay?
Sounds awesome.
Okay. So if you don't mind, we'll talk through a couple of those exercises. So sitting at your desk all day, I would suggest too here, if we can scapular retract. So think of your shoulder blades pinching together in the back, right?
Okay.
And I want you just to hold that for like 10 seconds and then you can relax. Hold it for a good 10 seconds and then relax. How does that feel?
It's challenging.
Yeah, we're a little weak back there, so we want to start strengthening that up. The other one is we like to go with, or you like to go with your head back into extension, and we can work with that by doing little chin tucks. So if you want to put your finger on the front of your chin and think about pushing your chin straight back.
My hand's pushing my chin back?
You can help pull your chin back, but this is here for just to help. Just to help get the idea.
Okay.
How do those feel?
Also kind of challenging, but I do like how I like how my head feels at the end.
Okay. So as we go on, I would like you to try and do this every hour for a little bit, right?
Okay.
Do some scapular squeezes, do some chin tucks. Does that sound okay?
Yeah.
Okay. Then additionally, hopefully, if you're okay with all this, I'd like to see you like twice a week for a couple weeks here to try and get some of that irritation and compression down, and then we can talk about going down to once a week, every other week. That way when we get this irritation and compression down, we don't have to come back here, right? And we can keep all those symptoms away.
Okay.
And you can get back to your gardening. Sound good?
Sounds like a plan. Hey Bernie, so I'm the last student physical therapy you're going to be seeing today. So again, we just went through a whole bunch of different things for this evaluation today. So the last thing we're going to do is a couple of different exercises to hopefully make some of that pain get a little bit less, okay? So the first thing I want you to do today is, can you lay down, put your head on this pillow that's right over here? Alright, So again, it was a little bit aggravating stuff we were doing. So what I'm gonna do is I'm just gonna give you a little bit of distraction for your neck, okay? So hopefully this can help.
Feels
some of those-
great.
Perfect. So hopefully some of these symptoms you're feeling kind of help. Maybe don't go as far down your arm. Kind of work its way back up, and overall just feel a little bit better.
Yeah.
So as I'm doing this, I'm going to explain to you again, or talk some more about that at-home plan that you talked about with your last physical therapist that was here. So again, try to keep doing some of those exercises like those chin tucks at home, and really focus on that posture, because that's going to be a really important thing to do, just to help some those symptoms really not show up as frequently. So at the desk, again, just stand up, take those breaks, make sure you take time to really focus on just moving your body around. It's going to be really important. So after that little session right here.
How long are we doing that for?
This distraction that I was just doing?
Yeah, it feels great. How long?
Well, I only did it for a couple minutes here. That was about 4 minutes of this, but I was also giving you some more education on your at-home
Gotcha,
plan.
okay.
So that's about as long as I was doing that. For this next one though, I'm gonna do a little exercise with you, okay? I'm gonna readjust this pillow a little bit.
Okay.
So there, you put your head back down.
Oh,
So,
that, yeah.
yeah, it probably didn't feel too good lifting your head, okay? So what I want you to do is try to remember that chin tuck we talked about earlier. Can you try to do that, but push your head a little bit into that pillow? I want you to hold that for about 5 seconds, okay? Alright, awesome. So we'll hold it for 5 seconds. Can we do that about 10 times? We'll do 2 sets of this. If this is aggravating at all, just let me know too, and we can stop that.
It is a little bit sore, but I can
Okay, a little
push
sore.
through.
Okay, perfect. So after we
Once I get to that end range, it feels nice.
okay, perfect. Well, after that, I know you just finished your 2 sets of 10 right there. You did it super quick.
Yeah.
The next thing I want to do is another exercise. So we mentioned that this is kind of like a nerve issue, right?
Yeah.
So one thing that nerves can do is they can move through space, like through your tissues. So the thing we're going to try is called neuroflossing. So remember how we put your left arm out
Yeah, I
and
didn't like
it
that.
really didn't like it, right? So we're going to try that on your right arm first. You can see what this feels like. So what I'd like you to do, get in that same position. We brought you up into here, right? Well, you'll be doing this on your own too, so I wouldn't be pushing on your arm at home. But you could hold your arm down at home if you wanted to. So can you lean your head to your left for me? So by tilting your head that way, we're kind of stretching out that nerve that's in your arm. And then as we kind of work our way down, can you lean your head to your right now? So now we're working up in this space here. So can you do that motion on your own, going back and forth like that? So from up top, then rotate all the way down. So here, we should be putting that nerve on too much tension. We're just helping it move in that space. Now, to kind of, you shouldn't feel any of that tension, super tight tension that you felt in the left arm. Can we try that on the left side now? I just want to see how much you can do here. I know it may not feel great, but what can you do here? So can you lean your head a little bit to the right at all?
Oh boy.
Okay, then just work within that space. Don't go too crazy, okay? Let's move that down. Awesome. And then back to the right. This is something you can do at home as well if you'd like to, but we're gonna do this 10 times on each side. Again, we're gonna do it 2 times through. And if there's any aggravation here, or your symptoms start to get a little bit worse, again, we can stop here. All right, good job. Way to do 2 times 10 on each side. And the last thing we're gonna do today, I'm gonna give you a little bit of a push through just up here. So there are some research articles out there as well, or out there that show that if I can help create some more motion in that thoracic spine, so kind of where your ribs are, that it does have a positive outcome on the chance of these symptoms diminishing. So what I'm having you do is, can you give yourself a really nice, big, tight hug here? All right. Again, if there's any issues here, if you notice any pain, just let me know, okay?
Okay.
So what I'm gonna do is I'm gonna roll you onto this side, okay? And I'm gonna try to find a spot that's a little bit tight. Right about here. All right. So I'm gonna roll you back over here. All right. Still doing okay?
Yeah.
All right. I'm gonna tuck that up in here a little bit. All right. Still doing okay?
Yeah.
All right. Your neck is still doing good?
Yep.
Okay. All right. So what I'm gonna do is I'm gonna give you a little bump, okay?
Yep.
So a little bit extra force right here. All right. Ready? Okay. Good.
Yeah.
So I could do that at a different spot as well if I felt some more limitations, but I just did it 4 times right there, and I got all the spots that I wanted to. So again, if that's bugging you at all, I could come up here, if this was irritating location, I'd come up here and I maybe help talk again about some more at home stuff, just to hopefully send you home with they'll send as present as they were when you first came in. So